So please introduce yourself and just explain a little bit about what your practice is.
Sure. My name's Ashley Fuller, and I'm a gynecologist at Swedish Medical Center here in Seattle. My practice is gynecology only, so I don't deliver babies anymore. And I focus on menopause, sexual health, hormones, and like vulvovaginal diseases.
Um, so what are the causes for PCOS and what are the most common signs and symptoms that you see?
Yeah, I think PCOS is a really interesting disorder because I think it's really poorly named. A lot of my patients think that it's about having a lot of cysts or big cysts on their ovaries, but really what it is it's a miscommunication between the brain and your ovaries. So every month when you're getting ready to ovulate, your ovary makes what's called a follicle. And it could be called a small cyst, but it's really a follicle. And that follicle gets bigger and bigger and bigger until your brain releases a hormone called luteinizing hormone partway through your cycle, and that tells your ovary to release that egg. So what happens in PCOS is that for some reason, the ovary never gets that message. And so it just kind of keeps making more follicles that build up in the ovaries. And so that's what the cystic part of it is. It's not really cysts. It's this buildup of these extra follicles in the ovaries. So if you looked on ultrasound, you would see a lot, we call it almost a pearl necklace kind of look to the ovaries because they have all these extra follicles in them. So that is like the underlying, I don't know if it's cause or the underlying etiology of PCOS. And why does it happen? We don't really know. We think there can be somewhat of a genetic component to it. We know it can run in families. We know that there is some insulin resistance involved in it. So insulin is like what helps us break down our blood sugar. We can sometimes have insulin in our bodies and it still works, but it's just our body is a little bit more resistant to letting it work well. And so it sometimes happens in women who are more overweight or in women who are obese. But I definitely see women who are slender and can still have PCOS. So that's not the whole story. And so, some of the side effects of having PCOS, because women are not ovulating, their hormones get really confused. And so the normal hormonal cycle of a menstrual period gets off because there's no ovulation. And so they usually don't have periods. Sometimes they'll go a month or two without a period, or sometimes they'll go months or even a year without a period. And for some women that's okay if they're using like hormones like birth control pills to keep the lining of their uterus thin. It's okay not to have a period. But for women who have PCOS, that lining of the uterus is getting thicker and thicker and thicker each month that they don't ovulate and don't have a period. And that actually can be dangerous and actually can put some women at higher risk for uterine cancer. So one of the things we do and also the other factor of PCOS that we see is because of that hormonal confusion, you get extra androgens, which are your male hormones. So we all have testosterone in our body and another one called DHEAS. And those are made by the ovary and your adrenal gland. And we get extra of those in PCOS. So these women might find more acne, sometimes some hair growth on their chin, sometimes some hair like on their belly, things like that. And so those are kind of the main tenets of the PCOS. And so you mentioned, I think the other part of your question was how you treat it. Is that right?
Yeah.
Okay, sorry. I'm kind of giving you my whole spiel and not letting you ask questions, but I'll kind of tell you everything and then you can ask me more questions. But so one of the main ways we treat this is by using birth control pills. And the reason we use birth control pills is two reasons. One, it kind of takes over those confused ovaries and kind of suppresses ovulation, which so the ovaries are no longer confused and it gives you an even level of hormone each day of the month. And then when you stop the birth control pills each month for a week, then you actually get your period. So it keeps the lining of the uterus thin and it causes women to have a regular period. The other great side effect of it is that our birth control pills actually reduce our testosterone a little bit. And different types of birth control pills do that more so than others, depending on what type of progesterone they have in there. And so certain birth control pills will actually help with the acne and some of the hair growth and some of the side effects that come with PCOS. Other treatments would be things like lifestyle changes, so healthy diet, exercise, weight loss for some women. Sometimes we use diabetes medications to help with that insulin resistance. Sometimes do that with patients who are actually trying to get pregnant. Sometimes it can help make them ovulate.
So, what age range of women have you typically diagnosed with PCOS?
I mean, I think any woman, past, the first year or two that you have your period, when you're young, your ovaries are still kind of confused and not really into a regular cycle, but probably as early as, 15, 16, depending on when women get their first period, girls get their first period, you could probably diagnose it. And then as long as they're having periods still and they're not in menopause, which usually happens in the early 50s, then women can have PCOS.
Are your patients typically aware of what PCOS is?
Somewhat, but I think a lot of women think that it's about cysts. And so it's a really common complaint that women come into the gynecologist office saying, I have cysts on my ovaries. But it is really normal to have a cyst on your ovary because every month, if you are ovulating, so if you're not on a hormonal birth control pill or anything like that that suppresses ovulation, then it's normal to make a cyst. When we ovulate, an egg bursts through the stroma of the ovary, and when it does that, it makes a small cyst. Now, sometimes those can get bigger, like if it bursts through a blood vessel, then that cyst can fill up with blood and get more painful and be called a hemorrhagic cyst. Those usually go away on their own, but they can be very painful. And sometimes women need surgery, although not very often. But a lot of women think that that is what PCOS is. And that's why I kind of hate the name PCOS, polycystic ovarian syndrome, because cysts are somewhat normal, although they can be dangerous. But that's not really, like I said at the beginning, what the PCOS is about. It's really about not ovulating and getting those extra follicles in. So I think a lot of women are confused about what PCOS is.
I think that's it.
Yeah. Actually, one more question. What are the diagnostic tests and screening tools you use to diagnose PCOS?
Perfect. That's a good question. So we use this thing called, I think it's the Rotterdam criteria. I can't remember the actual name of the criteria. I think that what it is, but it's you have to have two of the three criteria to meet the diagnosis. So one is less than normal regularity of your period. So women who are skipping periods or having cycles that are more than 35 days in between their periods. Either increased androgens, so testosterone and DHEAS, either on laboratory values if we check labs, or by clinical diagnosis, so having the extra acne or hair growth, things like that. And then third is that appearance of the ovaries on the ultrasound with the extra follicles, and they usually look at the volume of the ovaries because the ovaries get bigger because of all those extra follicles. And so they have to have two of those three. So if a woman comes in to see me and she's having a period every 3 months, and she tells me she has some hair growth on her chin and some extra acne, I can probably tell just from those two things from her history that she likely has PCOS. We could choose to go further and get an ultrasound to look at what her ovaries look like and look at her laboratories, but we don't necessarily need to. I do think too that my patients who have PCOS that are concerned about infertility, although it can lead to infertility, the main reason women with PCOS can't get pregnant is because they don't ovulate. We do have a lot of good medications that can make women with PCOS ovulate, and so that usually helps. And then the other thing is, if that doesn't work, women with PCOS have a lot of eggs in their ovaries because they're not ovulating, right? And so they tend to do really well with an egg retrieval for either egg freezing or for IVF, because they get a lot of eggs compared to like a woman with PCOS, the same age as a woman without PCOS. Probably that woman would have a lot more eggs able to retrieve from their eggs if they were going through an in vitro fertilization process. So there are a lot of options for women with PCOS still to have babies.